Hey guys, this is Dr. Hub. Today we'll look at the MRSA. So what is MRSA? MRSA stands for the Methicillin resistant staph aureus. That is the staphylococcus aureus. So to begin with the definition. So methicillin, that is nothing but the MIC, the 8 microgram per ml or more, and oxacillin is the MIC 4 microgram per ml or more. So there is a resistance. So the resistance in the MRSA is mediated by the MECA gene. It is mediated by the MECA gene. So this is chromosomally coded. It is chromosomally coded, and it alters the PBP. So what is PBP? It stands for the penicillin binding protein, and this is present on, so the penicillin binding protein on the staph aureus cell wall, and to the PBP2A, so which has a less affinity to the, and this is to the beta-lactam antibiotics. So first we are going to see the penicillin binding protein. In case of the penicillin binding protein, they are the normal proteins present in the bacterial cell wall. They are the normal protein which is present in the bacterial cell wall. Next, they are the transpeptidase in nature. They are transpeptidase in nature. And next is, they are required for cross-linking of the peptidoglycan layer. They are required for cross-linking. And this is of the peptidoglycan layer. Cross-linking of the peptidoglycan layer. So cross-linking of the peptidoglycan layer, and this is essential for the cell wall synthesis, Next, in the penicillin binding protein, it is also the site of attachment. So it is a site of attachment. The site of attachment for the beta-lactam drugs. To bind and inhibit. Now let's look at the types of MRSA. So under the types, there is the community acquired. So this is mediated by, the MECA subtype 4. And they possess a PV toxin. A PV toxin stands for the Panton Valentine toxin, and monodrug resistance, and it is more virulent. So monodrug resistance, and it is more virulent. Next, we saw the community acquired. Now we'll look at the hospital acquired. So in terms of the hospital acquired, this includes, it is mediated by the MEC, it is mediated by the MECA, and this will be the subtype 1, 2 as well as 3, and it's multi-drug resistant, and it is less virulent. Next is we look at the detection of the MRSA. So how is the MRSA detected? So under the detection of the MRSA, the antibiotic susceptibility test. There is the antibiotic susceptibility test on the Muller-Hilton agar. On the Muller-Hilton agar. And this is nothing but the disc diffusion test. So this is by using the methicillin. So using the methicillin or the oxacillin disc. Methicillin or the oxacillin disc, or the cefoxitin disc, or the cefoxitin disc. Next, for the detection of MRSA, there is also use of the PCR. The PCR is for the detection of the MECA gene. Then comes the aspect of treatment. How do you treat? So here there is the role of the vancomycin. So vancomycin is nothing but the DOC. What do you mean by DOC? Is nothing but the drug of choice and should be used only if the other drugs are resistant. When the other drugs, they are resistant. So what are the others? Others, they include the ticoplanin, then comes the linezolid, then there is also the streptogramine, then comes the cipro or the levofloxacin, and there is also the cotrimoxazole, the clindamycin, as well as the mupirocin, as well as the minocycline. Next, we will move on to the newer drugs. So what are the newer drugs which are available? So newer drugs, it includes there is daptomycin, then comes the ceftobiprole, then there is also the tigecycline, oritavancin, the dalbavancin, telavancin, then there is also the delafloxacin. Then comes there is also the ceftobiprole. There is a ceftobiprole as well as the ceftaroline. So all the ceftas. So they are the 5th generation beta lactams. The 5th gen beta lactam, and they are effective against the MRSA. They are effective against the MRSA.